So it's my really great pleasure to introduce Tony Chow for the Hall of Honor. Tony was one of my mentors, my 3 world-class mentors, and I owe a lot to him. Before I introduce Tony, though, I want to digress a little bit. Tony's recruitment here, as was mine, was really entirely dependent upon Dr. John Dirks. And I'd hoped he might be here on the line, but I guess he's not. But John had a vision for our division, as he had for many divisions in the Department of Medicine. And so when I came in '77 and Irv Salit came a year later, our plan was always to recruit a senior person to be division head. And very quickly, Tony came to the head of that list. And in 1979, we succeeded in recruiting Tony here. So Tony did his MD at University of Manitoba, as did Grant, as did I. All of us got into infectious diseases actually from Dr. Alan Ronald, one of my other mentors. So Tony interned in Calgary, went back to Manitoba, and then did his fellowship in UCLA at Torrance, and then went on to quickly get a faculty position there, be head of or chief of the department, associate professor, and then we stole him. And so that was one of our coups. And he came here as the founding member to head the division. Now, one of Tony's unanticipated challenges of coming here, though, which we were talking about at dinner here, he had to put up with me and Irv Salit. Now, Irv Salit and I both have a love of punning and an unusual sense of humor. However, Tony survived us. He probably learned to ignore us. And he really went on to quickly develop a really strong division of infectious diseases. And he stayed in the position of head until '93. He then started a whole host of other really neat endeavors for the department and UBC. He began the program of translational research and development of clinician scientists in Canada. He went on to head the MD PhD program, which still exists. And Tony was saying at dinner tonight that there's something like 60 applicants for 5 positions. It's an incredibly productive program. He developed the CIHR strategic training program for translational research that again helped to move research from bench to bedside and back again. And along the way, through his career, Tony had over 420 peer-reviewed publications in numerous areas. Tony made numerous other contributions at multiple levels with the Infectious Disease Society of America, with the federal government, and locally he received a variety of honors. He received the VGH Medical Staff Association Academic Award for Scientific Achievement in 1992. In 1996, he received the UBC Faculty of Medicine Distinguished Medical Research Award. In 2006, he received the Whitlow Medical Grand Rounds Award. And then since his retirement, Tony hasn't quit. Our division runs a weekly journal club and weekly intercity rounds that are very successful. And Tony is often making astute, helpful, clinical, and research-oriented comments. So like a good scientist, he won't quit. So fantastic. Tony had other significant innovations in patient care. In 1982, along with colleagues in pharmacy, he developed a really strong program in what is now called antimicrobial stewardship. We still have usually full-time infectious diseases pharmacists with us. He established in '93 the first of 3 Royal College certified programs in infectious diseases here. At the faculty level, he was chair of the Faculty of Medicine Curriculum Evaluation Committee and founding director of the UBC Experimental Medicine Graduate Program in Infectious Diseases. Tony's received numerous awards along the way. Some of them are in 2013 from the Association of Medical Microbiology and Infectious Diseases of Canada, which is our Canadian association, the Lifetime Achievement Award. And in 2017, the Brandon University awarded him the Alumni Wall of Fame Award in honor of alumni who have made significant achievements in their career on the provincial, national, international level, bringing honor and prestige to our university. So just in closing, Tony has done something that very few academics ever succeed in doing. Tony was a star as a superb clinician. His comments suggest that he is still a superb clinician, although I don't think he lays his hands on patients anymore. He was a dedicated teacher. One of the anecdotes of us old geezers in infectious diseases is that ID used to round regularly till 8 or 9 at night. And then Tony would take people over to Bill Key's for dim sum. That was a regular tradition. Tony's a renowned researcher. I mentioned this earlier, but literally working from the lab to the bedside and back. And then on top of that, as you've heard, Tony is a strong innovator and a builder. I stand in awe of Tony's accomplishments. Thank you, Tony.
Thank you, Bill. I don't know who you were describing, but I am really, really honored to be here. I feel like I'm giving a thank you speech at the Academy Awards. So firstly, I want to thank the Vancouver Coastal Health and the VGH medical and dental staff for selecting me for this great honor, and it's really appreciated. Now, there are many people that helped me along the way in my academic career, but I must mention 3 individuals who were pivotal in my success. And first is, as mentioned, Dr. Alan Ronald from the University of Manitoba, for setting me on the path to pursue the discipline of infectious diseases. And the second is Dr. Lucien Gouzet, my mentor from UCLA, who taught me all the clinical and research skills and inspired me to become a clinician scientist. And last but not least, again, as mentioned, is Dr. John Dirks, who was the former head of medicine, who recruited me to UBC and gave me free rein to develop ID, both at VGH and UBC. Now, there's one more person I must acknowledge for facilitating my coming to VGH, and that's in addition to Bill Bowyer, who first gave me the idea of the possibility of coming here. And that is Bob Chan, an old friend, classmate, good friend, who both trained at UCLA. And shortly after I received the offer from UBC, I called up Bob, Bob was actually among the first to practice infectious disease here in Vancouver. So I asked Bob, should I come to Vancouver? And Bob answered, no. They're kind of backward here. You wouldn't be happy. And of course, as soon as I heard that, I knew I had to come. Because if they're backward here, surely I could make progress and move it forward. So Bob, if you're listening in on Zoom, thank you for those comments, which really helped me make up my mind to come to Vancouver. Now, I must also thank our division members, particularly Bill and Grant, both here. Grant, who has been a big help to me as associate head of the division. And it really is the collective effort of the whole division over the years that made infectious diseases such a superb specialty, not only at VGH, but also within Canada. Lastly, I want to thank all our trainees over the years, and it's really because of them that has made all our efforts worthwhile. So with that, thank you again for selecting me for this great honor.